Good afternoon and welcome back to Transformation Thursdays, where we highlight some of our agency's impactful work here in Northeast Louisiana. My name is Katie Terrell and I'm so excited to be with you here again today on this episode. I also have a special co-host on today's episode, Mr. Daniel Perea. Daniel is our Public Information Director here at Northeast Delta Human Services Authority. You might see more of him moving forward in this series and at our upcoming events. He's a great asset to our agency, and I'm so thankful to have him today co-hosting with me on this episode. Let's give a big Transformation Thursday welcome to Daniel Perea.
Thanks,
welcome
Katie.
In, Daniel.
Thanks, Katie. It's great to be here.
Okay, so our mission at Northeast Delta, as a reminder to everybody, is to serve as a catalyst for individuals with mental health, developmental disabilities, and addictive disorders to help them realize their full human potential by offering quality, excellent care with greater accessibility. Our vision is to build a unified Northeast Louisiana where individuals are thriving and reaching their full human potential. The three tenets that guide our actions are greater access to services, excellent customer service, and quality, competent care. It is Thursday, April 23rd, 2026. Today's episode will focus on a transformative initiative that we will expand access to life-changing technology resources here at Northeast Louisiana. There's been a lot of work and anticipation building about this partnership behind the scenes, but we are so excited to finally bring that to you today and tell you more about it on Transformation Thursday.
Thanks for tuning in. N.T.A.C, which stands for Northeast Technology Access Collaborative, is all about expanding access and opportunity in our community. From a public information standpoint, one of our biggest goals is making sure people know these services exist and understand how to access them. Whether you're an individual, a family member, a provider, or a community partner, N.T.A.C was designed with you in mind. Today's conversation is about more than just a new initiative. It's about breaking down barriers, raising awareness, and ensuring no one is left behind when it comes to technology and accessibility.
Thank you, Daniel. Yeah, our two special guests today, too, are the best individuals to help us share what this collaboration really, truly means for Northeast Louisiana. So first, Ms. Yakima Black is the president and CEO of LATAN, which stands for Louisiana Assistive Technology Access Network. Second, Mr. Jimmy Powell is the Director of Developmental Disabilities here at Northeast Delta Human Services Authority. So welcome, Ms. Black and Mr. Powell.
Thank you. Thank you. Super excited to be on with you all today.
Yep, it's great to have us here. Thank you.
Okay, so to start us off, can each of you share what excites you the most about launching the Northeast Technology Access Collaborative here in Northeast Louisiana?
I'll start first. So we're really excited about the opportunity to have a deeper presence within the region. The region that you all serve is 12 parishes, and while we have provided services throughout the state, your region has it is mostly rural communities, rural parishes, and this partnership will allow us to just simply have more of a connection there because we know you, because you all are connecting us with other organizations and services that we've not had contact with in past years. And so it's really a great opportunity for us to simply have more of a presence.
Yeah, and we're really grateful for this partnership and happy for it. We've known of LATAN for a long time, and we had an agent in this area a long time ago. And we really want to bring the services here to our people in our area and have them in with us. It's just such an important resource, and now with more services available in the waiver, we want those services here where people can see them up close and look at them and know what they're getting. So we're real excited about working with LATAN.
Yeah, I think Ms. Black, you mentioned a little bit about this whenever you were introducing kind of why you're so excited about this, but for listeners who might not be familiar, what problem is N.T.A.C aiming to solve in this community?
We're hoping to increase awareness of and access to assistive technology. Prior to this collaborative and probably over the last 2 years, real assistive technology that is not durable medical equipment is typically only available under medical necessity and covered by insurance in that way. And so people don't necessarily know about technology from a standpoint of assistive technology as opposed to a wheelchair, walker, or shower chair and those durable medical equipments that people are traditionally familiar with. So this, what we hope to solve is more of a understanding about the true benefits of how assistive technology can be used to increase independence in everyday life and different types of activities that people want to perform.
Yeah, and I know we'll probably get to that a little bit later also, but yeah, I think that, sometimes when we are in rural communities, people just assume that those things aren't close to them, and that they might not have the resources or the time or the capability to drive down to Baton Rouge or to go somewhere where they perceive is going to be where they have to go to get more information about that. Right. And so I know that that's a huge goal, is just to try to get those resources available, but they're not going to do us any good if people don't know about them. So it's really, this collaborative is all about that partnership to make sure that we have those things available here in Northeast Louisiana, but also that people know about it. So, and that's really a big goal of today's episode. So yeah, I just thank you all so much for joining us today, because I know we're going to dive into this even more as to why this is so important for us. So Jimmy, from your perspective as the Director of Developmental Disabilities here, what are the biggest barriers individuals with developmental disabilities face when it comes to accessing technology?
I'm going to talk about here locally, I guess, and with the people we work with in our area. We're very rural, and a lot of times if people don't see something on TV or online, they're not going to ever see it unless somebody is in their community using the devices. And so, and with people not having a lot of access to technology and stuff, they're unfamiliar with it. They're kind of nervous about it. So I think obviously that's two huge barriers, just access and also people being comfortable with it. But then you also have the cost factor, like Yakima mentioned earlier, with insurance, and just the cost of some of the equipments are prohibitive for people. So I think just what we've been talking about, those barriers with just understanding what is out there, what's available, and then once it's out there, how do I get this and do it? So I think across the board, even not just with the disabilities, but anybody in our community that needs assistive devices, I think that's just what we're facing around this area.
And that, correct me if I'm wrong, it doesn't have to be the disability, or the reason why they need the assistive technology doesn't have to be because of their disability, right? Like they could come engage with us even if it's not directly related to their disability.
I don't want to speak out. Like this program we're doing is not just for people with developmental disabilities. It's for anybody with any type of disability. And a lot of times we use assistive devices every day, and we may not think of ourselves as having a disability, like my reading glasses. They're a disability if I don't have them, but if I do, they're not. So I think in that vein, yes, we're open to the public. We're open to families to look for ideas for all of their family members. We're going to be working with the elderly veteran population and school kids too. And so in that respect, now I do think as far as getting assistance to pay for things, especially through the waiver and some of the other programs, people have to have disabilities for that. But we're going to do this so we can make this aware to everybody. We're going to have, and I'm probably getting ahead of your questions, but we're going to have events, and we're going to travel to parishes where we can show people these things up close.
Awesome. Yeah, that's what I was kind of hoping you would talk to a little bit, just so that although it is going to be housed at the Developmental Disabilities office, that it doesn't have to be related to a disability as to why someone might be accessing disability, but not one that's through the Developmental Disabilities office, right?
Yes.
So, I mean, I know that we're doing this as an agency because it does align so much with our mission and our services that we already provide. Can you talk a little bit more about how this N.T.A.C initiative fits into NEDSA's broader vision and services?
Yes, ma'am. Like you mentioned at the beginning about our mission, or individuals are thriving and reaching. We want individuals in our community to be thriving and reaching their full human potential. And part of the way we do this is greater access to services. And we do a lot of things like that in this region. We've we're working on a Phoenix clinic with behavioral health to bring those services to people with developmental disabilities. We work with general pharmacy to bring services to people in the community they may not have access to, or at least to get it better and easier. And it also works with our agency. So, and we partner with all different types of groups. I can't name them all here. They have their own transformation Thursdays, but all these groups and all these initiatives that we're doing are to get these things to the community. And this is just an additional thing. So when I'm sitting and talking with Dr. Sizer and we're going through, all the different ideas for ways to increase access in our department, one of the biggest needs that comes up frequently, and also with new additions to the waiver program for some of AT services, is just having a presence up north for the AT services. So that's what we're doing. We were really excited about it. We already had a relationship with Yakima from a previous pilot we had done. And LATAN, we love LATAN services and have been working with them. So we're like, this sounds like the next step we want to do in our department.
Awesome. Yeah, I can see that. I can see how well we already are working with LATAN, and that's because of this relationship that we've already built with them. So, and because obviously Yakima and LATAN have very similar goals and very similar mission that we do. So what impact, Jimmy, are you hoping this initiative has over the next 3 to 5 years in Northeast Louisiana?
Well, what I hope to see, I always go a little big, so I'm gonna have to back it up a little bit, but what I hope to see, when I was saying initially people in rural areas and stuff don't get to see this stuff a whole lot. Well, I'm hoping one of the things that we want to do, we're going to start taking these to those areas. So one of my hopes for the future is people in these rural areas and the agencies in those areas and they're going to see these devices, know about them, recommend them, and they're going to be able to see them in their community, recommend them to their friends and their family members. And I think it's just going to grow. I think once the word gets out and people start using the items and we work through the process of the flow here, that's what I look for. I just look for it to grow and be bigger. Of course, I envision a larger area for showing off stuff to people and everything down the road. But I think right now, really getting the word out and making people feel comfortable about using the technology, I think that's where I see us.
Yeah, I appreciate that because, meeting people where they are is so important with something like this, with technology, obviously with their location, but even just the comfortability of using technology. I know sometimes technology can be so daunting or it can sound overwhelming to learn a new technology. And sometimes it just takes getting your hands on it and playing with it and trying to figure it out for yourself before you feel comfortable. So I think that's a great opportunity for this partnership to be able to do that and provide that for people.
Great. Let's bring Yakima into the conversation. So as an organization, can you tell us a little bit about what is the role of LATAN?
So we are the Assistive Technology Act program for the state of Louisiana. And essentially what that means is that under the 21st century AT, I just had a pause for whatever reason. There are 56 of us across the country, including the District of Columbia, also Puerto Rico and 4 territories. And we essentially all do the same thing. We are providing access and awareness to AT, but through demonstrations, which is what we're talking about with this partnership with N.T.A.C, is to have technology available for people to come in. And Katie, I couldn't have said it better, of letting someone touch it, feel it, see what it's about. And also with device loans and looking at how you acquire AT and also providing education along the way with that. And so I did say we're federally funded by the Administration of Community Living, which is under the United States Department of Health and Human Services. Our partner in Louisiana is you all, the Department of Health here in Baton Rouge, and then regionally with the local governmental entities.
So what is LATAN not? Or in other words, do people sometimes have misconceptions of what LATAN does?
Yes, oftentimes people believe that we're a state agency, and which is why it's so confusing when we say the state N.T.A.C program, but that's just how we are defined under the legislation. And if we were meeting with Congress, Congress knows us to be state AT programs because we provide AT to the entire state of folks, and that's the program itself. But people will believe that we're a state agency, or that we are a for-profit traditional provider agency is what we're, misconstrued as being. But we're not. We are, as I mentioned, we are a nonprofit. And again, following the path of what the legislation design charges us to do, we are essentially here to, however it looks, expand our services. And it's gone from just getting people access to the device, but there's services that go along with that. There's assessing someone's need for those devices and helping them to decide or to really expand on what type of activities that they're interested in performing. And also there's a little bit, or maybe a lot, of what we call information and assistance. And that could be connecting someone, not just with the technology itself, but there could be services that were identified outside of what we do that another organization is providing. So it's a bit of case management that's included in there as well. And so I think that those are probably the two areas that are most misunderstood when people hear about us. Oh, and that it has been really important for us, especially in the last 10 years, to brand and make sure that folks don't just understand that we are providing to one group of people or people with disabilities. And just to expand on that a little bit, in AT service delivery, we don't, someone's medical condition is not what creates the quote disability. It's the environment. It may be the lack of a payment source to provide, to pay for that AT that's creating it. It may even be cultural or social. There's other barriers within our world that creates the limitations that people experience. And so what we say is that assistive technology, it enables people to perform activities that they need to perform across communities.
So speaking of communities, some are more urban, some are more rural. In the past, have you seen obstacles in reaching the more rural areas?
I have. We had an office. We had two offices. One in Baton Rouge, our main location, and then the other that was in Shreveport. And so we would essentially have, with staffing, divide the state between, I always say this and I think of this show, but the North and the South. And so Alexandria and above and Alexandria and below. And then across east to west of the state. The challenge is, and which is really so beneficial that we're doing this with you all today for Transformation Thursday, is that it really is the lack of awareness in rural communities. And it's not just with assistive technology. I think across the board, and I can say this because I am from a rural community, we simply will do without. If something is not readily available to you, if you're not aware that it's there, you don't know to ask for it is the first thing. But if if you've not heard of it, then you're just not going to ask for something that's there. Or if there are some obstacles to obtaining it, a couple of different other hoops you have to jump through. Maybe it's something expensive that you need and you know you need it, but there's no avenue to pay for it. You just simply make do. And I think that happens across the board. And I'm not saying that doesn't happen in urban communities too, because there's limited access, no matter if we're talking urban and rural, because it really is dependent upon that population of people and where they are within those communities. But it's easier, and oftentimes more available that services are in our major cities in Louisiana versus St. Joseph and Tensas Parish. So, I think that us being able to use social media, to use avenues like we're, talking like we're doing right now, having this type of forum, it's going to allow us to just expand our reach and and connect with people who would not connect with, which includes, again, people who, don't identify themselves as having a disability. For instance, the veterans population, right? Or school-age kids, etc.
So that's a good transition into my next question. And you touched on that briefly a minute ago, when people think of assistive technology, they may think in terms of maybe a mobility device, maybe some kind of prosthetic, but it's so much more broad than that. Mm-hmm. Can you explain some examples of AT use that people use every day and they may not even realize that it's considered AT?
Sure. I'll start with first the definition. Assistive technology or AT is any device, tool, or software, equipment, etc. Can be a person as a soft technology that's assisting someone doing something. And we've certainly seen service animals, but it's anything that's used to increase, maintain, or improve the capabilities and the quality of life of a person living with a disability or a functional limitation. So AT can be low tech, high tech, mid tech, and that has to do with the type of hardware and how complex the technology is in terms of how it works and functions. So from a low tech standpoint, an example would be, and April is also Autism Awareness Month, so I use this example for this reason. A weighted blanket. Weighted blankets also mainstream, but they're used to reduce anxiety, to ease sensory overload. Also, it mimics a hug, lowers stress, and also improves sleep. So that can be used by someone, and they're often used by people with autism, but also for someone who's trying to manage their insomnia, which, due to stress. And so there's a variation of that as well. You have other high-tech devices. They typically are a little more expensive. They have a lot more features in terms of how they function. But an example of that would be eye gaze technology that's used as an application on an iPad, which allows someone who's nonverbal to communicate.
Great. So does rethinking what AT is and what it can be, and also who it's for, does that help break down stigmas and stereotypes that people may have, or even unconscious biases they have around assistive technology?
Absolutely. And it is the stigma, and conscious and unconscious biases, which is why I mentioned about culture and social variables that we consider in terms of whether or not someone is going to be willing to use a particular type of technology. And that varies, that stigma, those perspectives just vary among age, among different groups. We're always considering those as we look for solutions for someone. But the more mainstream technology is, currently, and it's going to continue to become, the less stigma that and hesitation that people will have to use AT. Every last one of us are using AT right now. If we have a smartphone, be it an Android or an iPhone, we're using technologies to keep us safe from not texting and driving. So I have iPhones, so I'm using Siri that uses text to talk, and we all should be using that, or Apple CarPlay when we're driving to text for us or to not answer the phone at all while we're driving, to Alexa and the environmental controls that maybe someone who's living with paralysis, to allow that person to be able to control the lights on, or to control turning a fan on, or their television, or even to text by or making a phone call without the use of their hands. And so these things we use Alexa. We're using the same exact technology that someone who is living with, a particular medical condition or paralysis or stroke that everybody's using. And so because of that, technology becomes more accessible and also more widely used and accepted.
That's great. Do you have any success stories you can share of people's quality of life dramatically improving after they've kind of discovered some assistive technology, perhaps through LATAN or some other source?
Sure. We recently assisted someone who lives in a rural community in North Louisiana and is 80 years old and has been progressively losing sight due to glaucoma. And he's had to rely on others to read his mail, to read the prescription numbers on his medication bottle, for refills, to help pay bills, to go shopping, all of the instrumental aids of daily living. And unfortunately, those that he relied upon, there's been some financial abuse, or he's experienced that, where looking at money and saying that maybe that $20 was $5 as opposed to really what it was. And so we all want to be able to read our own mail, and it's just a really general task and right that we all experience, but we don't necessarily think about it unless you have to rely on someone else to read your personal mail for you or to go and pay a bill for you. And so we were able to do a demonstration with him with Meta glasses, which now Meta glasses are actually a mainstream technology. However, they can be used for people who have low vision or legal blindness because they can read what's in front of them and speak into the ear. And so he can hear and just look at a dollar bill or a piece of currency and say, "Hey, Meta, what bill is this?" And Meta will read for him and say, "This is a $20 bill." Or looking at his prescription bottle and I don't know why, because it's not accessible that they do this, but the numbers on the prescription bottle, even though they're highlighted, they're tiny. And I wear glasses too, so I can complain about that as well. But he can hold that bottle in front of those glasses, and they read for him. And so his life, and we've also paired with a smartphone because you do need a smartphone to work with the technology, and that has also using the smartphone as opposed to an antiquated flip phone. He has features that allow him to just simply say, "Hey, call LATAN," and or ask Siri or whomever for a particular phone number, as opposed to not being able to just get online and look something up. So he was at 80 years old being willing to learn a new tech and become familiar with it when he has not. So we're talking an old flip phone with the buttons. I think they're just standard phone, right? To using smart technology to do something that he had not been able to do. And that's just to own a little bit of privacy and have a lot more independence with, having some agency over his life. Another person that we were able to, that LATAN assisted, was a father and son who were worked in a yard together. This is up in North Louisiana too. And son is 12. I think he's 12 years old, and uses a wheelchair, does have a congenital medical condition that where he doesn't walk. But he's in the yard with dad, and they're doing gardening, and dad wanted an insurance would not pay for this because he already has a wheelchair. But what dad said was, my son likes to come outside with me, and the casters and the wheels on the wheelchair that he uses and in the house, and also on smoother surfaces, is not appropriate for the grass, and so he can't move around. And so we are willing, he took advantage of our lease to own program to purchase through us, leasing it during time to be able to purchase a specialized wheelchair that allowed for travel on the grass. And so that's all they wanted to do, was to be able to do gardening with Dad, in the yard, and it was done there. And so there's so many different ways that we pull all of the services that we have to bring resources in, and that's also understanding what payment sources are available for people, so that they can, again, perform whatever activity that they're interested in performing.
That's great. I mean, as you were talking about the Meta glasses, I was just thinking, it's so great that now some of the more mainstream technologies have things that can be used as assistive technology, because I think so much of, well, not always, but a lot of the stigma sometimes comes with like embarrassment, or, people don't want to draw attention to themselves maybe. And so being able to utilize a device that everyone uses, or that anyone can use for an assistive technology, has to break down some kind of a barrier, especially if that's why they're resistant,
Absolutely. And I think for the gentleman who had been losing his sight, for 30 years or so, that was a lot of the hesitation. He wasn't thinking about technology, but he also hadn't learned to live without sight. And so, because of the stigma, and so he tried to trust in people, to help him. And it's too bad you couldn't trust everybody, but also that prevented him from coming into, agencies like ours, or even Lighthouse for the Blind, to gain assistance early on with navigating your environment. And so he would never be someone who will use a white cane, and so had it not been for second generation Meta glasses, I doubt very seriously that we would have had something that he was willing to use, because years ago, I think we had tried out the CCTV, which is a really large really large monitor. It reminds me of the old classroom. You remember they would have the little projector thing, and the teacher would put the slides on there, and they would project on the large screen for you. And so, but these new CCTVs can tag to your TV or to a computer, etc. But it was something extra, and he was not willing to use it, and it was just because of the stigma. And so Meta glasses made it really a positive thing. They look cool. He still looks cool in it at 80. And so I think that those are real factors, though, in terms of whether or not someone will be successful. They have to feel comfortable with whatever it is.
Absolutely. Okay, as you can see, we have so much to talk about when it comes to this partnership. This N.T.A.C partnership with LATAN is going to be a big one. It's going to be great. But we're going to pause there for now. We're going to have part 2 next week at the same time, same place. But I do want to say thank you now to Mrs. Black, Mr. Powell, and Mr. Perea for their insights on today's episode. I also want to let you know, if you're listening today and you want more information about our services, you can always go to our website at nedeltahsa.org, or you can call us at 800-256-2522. Thank you so much for tuning in today, and thank you to our wonderful guests. If you want to stay up to date on our programs or events, the best place to go is to follow the Phoenix. You can do that on Facebook, YouTube, Instagram, LinkedIn, and X at NEDeltaHSA. All right, go be great today. We will see you next week for part 2.